Good morning, everyone. Let me start by asking, have you ever tried teaching something complex subject using just slides and lectures? Well, I have. And let me tell you, it wasn't always fun. I'm Sarah Zulkarnain from the Faculty of Medicine and Health Defense, University Pertahanan Nasional Malaysia. Today, I'm excited to share our project titled The Power of the Table, Igniting Critical Thinking and Collaboration in Pathology Education. This project was made possible through the collective efforts of our dedicated team. I am proud to collaborate with Dr. Wan Farhana, Dr. Siti Nadira, and Associate Professor Dr. Nani, our powerhouse pathology educators. And bringing a unique perspective is Dr. Ahmad Badu Rizanullah, a public health specialist from the Ministry of Health, with extensive experience in disaster simulation exercises. With these minds together, what could go wrong? Let's take a moment to talk about pathology. Pathology is often called the backbone of medicine. Pathology is the science that answers 4 key questions. What caused the disease? How did it start and progress? What changes happen in the body? And finally, what symptoms and signs does that create in the patients? In short, pathology connects the dots between basic science and real-life clinical practice. So that's why pathology is taught during second-year medical students before they enter clinical years. Despite its importance, pathology remains a difficult subject to teach effectively. Let me walk you through 3 key challenges. Number 1, limited clinical context and integration. Students often struggle to connect pathology with real-life patient care and the relevance sometimes lost. Number 2, abstract and complex content. We're asking students to grasp microscopic changes and disease evolution, all of which are difficult to visualize and internalize. And lastly, passive learning methods. Let's be honest, traditional teaching often still relies on static lectures and image-heavy slides. It's no surprise students feel disengaged. As Musabikova et al. Note, pathology shouldn't be confined to preclinical theory. It must be grounded in the clinical realities students will soon face. And as highlighted by Kashif et al., understanding pathology requires more than memorizing slides. Students need consistent study of key concepts, hands-on exposure to histology, lab diagnostic, and most importantly, clinical pathological correlation, where they see how pathological findings influence clinical decisions. Thankfully, things are changing. According to Koch, Chang and Dinzis, pathology education is transitioning from passive lectures to more participatory active learning models. So we ask ourselves, what if we flip the script? What if pathology wasn't just something students read or memorize, but something they could experience, discuss and apply, as if they were already part of the medical team? That's the vision that led to our project. Enter our secret sauce. Tabletop exercise or TTX, borrowed from the world of emergency and disaster planning and fused with team-based learning or TBL. TTX offer rich scenario-based role-play, while TBL a structured sequence of individual preparation, team collaboration and application-focused exercises. When combined, they form a powerful, immersive classroom experience. Let's kick things off. First, students do a quick quiz to check their basic knowledge. That's the individual test or IRAD. Then they team up in small groups to tackle the same questions together in the group round called GRAD. Once that was done, they jump straight into the tabletop exercise. In tabletop exercise, students don't just read about disease, but they act it out. They become the patient, the primary care physician, the surgeon, the pathologist, even the observer. And the best part, they solve real clinical cases together. They need to present the patient history in layman terms, asking relevant follow-up questions, justifying appropriate investigation and interpret them, explaining disease mechanism and pathophysiology of symptoms, and propose the medical plan. Now, we didn't just think it worked, we tested it. We developed a 19-question feedback tool combining Likert skills and open-ended reflections. We zoom in on 4 areas: exercise design and delivery, learning outcomes, facilitation and feedback session, and overall satisfaction. And then we ran multiple linear regression to see what actually predicted satisfaction. In other words, we made sure the numbers back the magic. Let's have a look at the pictures. So this is a group of primary care physicians discussing on the lab investigation results of the patient. And then this group need to refer the case to the surgeon in the hospital. And this is the group of surgeon planning and discussing what's the best management plan for the patient. And this is where the pathologist explaining the microscopic changes that happen in the patient's biopsy. This is where a group of pathologists explaining the disease mechanism and the pathophysiology of symptoms. This is where the group of observers giving their feedback on the performance of the other groups. And this is where the facilitator giving her feedback to the groups. So what did we set out to do? 3 things. First, evaluate the impact of TTX TBL integration on student learning outcomes. Secondly, to foster critical thinking and collaborative decision making. And above all, make pathology practical through application of pathology in clinical context. Here's what exciting. This is the first time TTX has been integrated into TBL for pathology education in Malaysia. It's both authentic because it's rooted in real-world cases and rigorous using the structured learning cycle of TBL. This project truly bridges theory and practice in one seamless framework, and the students, they absolutely love it. Our analysis reveals some key insights. The strongest predictor of satisfaction, learning outcomes. Students felt they genuinely understand pathology better. Facilitation and design also play important roles. And in their own words, students describe it as realistic, engaging, and team-oriented. Role-play wasn't just fun, it made the learning stick. Innovation demonstrates strong practicality and feasibility. Now, you might be thinking, this sounds great for small groups, but what about large classes? Here's the beauty of it. It scales effortless. You can have 50 students in a room, divide them into small teams, and run everything simultaneously. And with just one facilitator, you can manage the entire session efficiently. It's actually more efficient than running multiple small tutorials. And as the facilitator, you're not just standing at the front lecturing. You're in the room, observing, guiding, and providing real-time feedback. If a group goes off track, you step in and correct it. This approach isn't just for pathology. It's flexible. It can be easily adapted to other clinical disciplines or subjects. The same interactive team-based methods can bring any subject to life and boost student engagement. It also has a significant impact on students' learning experience. Instead of throwing theory at students and hoping it sticks, we give them clinical scenarios that mirror real-life situations. They don't just memorize pathogenesis, they apply it. Now, this isn't just group work. These are complex, layered cases designed to make students think deeply. They have to sift through symptoms, interpret findings, debate possibilities, and defend their conclusion. This is how we build clinical reasoning. And guess what? They actually enjoy it. Students describe this session as less stressful and more engaging than traditional lectures. They participate more. Now that we have seen TTX TBL in actions, let's think bigger. Imagine a ready-to-use module complete with cases, guides, and roll cards that any medical or health program can adopt instantly. But it doesn't stop there. We can offer certifications, workshops, and training to help educators run TTX TBL effectively, whether online or in person. And the best part, it's not just for pathology. This method works across fields: emergency medicine, public health, pharmacy, even leadership or disaster training. With institutional subscriptions, university could access a full TTX TBL case library, customizable, expandable, and always updated. Why now? Because education is shifting. TTX TBL delivers engagement, real-world skills, and measurable outcomes all in one package. We would like to thank the Faculty of Medicine and Health Defense, the Pathology Unit, and of course, the amazing second-year students who dove headfirst into this initiative. These are some of the references. Thank you.